This model focuses on environmental cleaning at healthcare facilities. At the end of this model, you should be able to describe the IPC guidelines for the proper cleaning and disinfection of the patient environment. Environmental cleaning is a fundamental intervention for infection prevention. There is sufficient evidence to show that environmental contamination plays a role in the transmission of infection in healthcare settings. It has also been documented that some healthcare-associated pathogens can survive on environmental surfaces for months. Environmental cleaning is part of standard precautions, which should be applied in all healthcare facilities as it affects all. As mentioned in the standard precaution model, there is a difference between cleaning and disinfection. Cleaning refers to the general removal of organic matter such as dirt, food, blood, saliva, and other body secretions that contribute to the proliferation of bacteria and viruses, while disinfection refers to the process of removing a significant amount of pathogens that cause infection or disease. Disinfection should be done after cleaning. Only items and surfaces that are frequently touched or that have come in contact with patient's skin and mucosa require disinfection after cleaning. Facility environmental policies should be developed to address the following: defined lines of accountability and functional reporting lines with clear responsibilities for all relevant staff. Cleaning schedules for every patient care area and non-critical patient care equipment, specifying the frequency, method, and staff responsible. Contingency plans and required cleaning procedures for outbreak management. Training requirements and performance standards for cleaning staff. Monitoring methods, frequency, and staff responsible. List of approved cleaning products, supplies, and equipment and any required specifications on their use. And list of the necessary PPE and when hand hygiene action is recommended for staff and patient safety. Let's look at the cleaning guidance for routine cleaning and terminal cleaning of the inpatient area for patients with acute illness where routine medical procedures are carried out. Routine cleaning should be carried out daily and as needed by the responsible cleaning staff. Cleaning agents such as neutral detergents and water should be used to clean high-touch surfaces and floors working towards the patient zone. Low-touch surfaces should also be cleaned on a scheduled basis, for example, on a weekly basis. Terminal cleaning should be carried out after patient discharge or transfer by the responsible cleaning staff. Cleaning agents and disinfectants should be used to clean high-touch surfaces, low-touch surfaces, and floors. Soiled or used patient care items, including linen, should be removed for reprocessing or disposal. All reusable and non-critical patient care equipment should be reprocessed and all surfaces should be cleaned, including those that may have not been accessible when the room or area was occupied. These are the steps for routine cleaning. First, perform an assessment of the area that is to be cleaned. Gather the relevant supplies that will be needed for cleaning or disinfection. Perform hand hygiene. Clean the patient area. Collect and dispose of waste appropriately, and then perform hand hygiene. These are the steps for terminal cleaning. First, perform an assessment of the area that is to be cleaned. Gather the relevant supplies that will be needed for cleaning or disinfection. Perform hand hygiene. Clean the patient area, the patient bathroom, and floors. Collect and dispose of waste appropriately, and then perform hand hygiene. The following are principles of cleaning. Always move from the cleanest area to the dirtiest area. Clean from higher level areas to low areas and from outer to inner. Clean the isolation areas last and with dedicated cleaning equipment. Damp dusting and wet mopping is recommended to minimize dust. A 3-bucket system should be used for cleaning and disinfection. Always use clean water for cleaning, and the spraying of disinfectants is not recommended. Non-critical frequent touch surfaces must be cleaned and disinfected on a regular basis. Floors, walls, windows, chairs, and other furniture used by individuals who are clothed and other non-patient care areas require only cleaning. Bed curtains should be changed when soiled and changed with every terminal cleaning. The following rules should be applied for appropriate environmental cleaning in the isolation rooms or areas. The frequency of cleaning in patient care areas should be increased. Isolation areas should have their own cleaning supplies that are separate from the clean patient care areas. All waste from the isolation area is considered infectious and should be disposed of following the facility's methods for infectious waste. Cleaners should ensure they are wearing the appropriate PPE when cleaning an isolation room or area, and the cleaning supplies for the isolation area should be kept in the isolation area and used there only. A color coding system should be used for cleaning equipment and supplies for different areas of the health facility to prevent cross-contamination. Yellow-colored equipment should be used for the infectious or isolation areas. Red-colored equipment should be used for toilets, bathrooms, and dirty utility rooms. Green-colored equipment should be used for food service and preparation areas. Blue-colored equipment should be used for general cleaning, and white-colored equipment should be used for the operating room or theater. The following steps should be followed when cleaning up small spills of blood and other body fluids. Prepare by wearing non-sterile gloves. Wipe the area immediately with a paper towel or absorbent cloth. The towels should be discarded as infectious waste. Disinfect the area with 10,000 parts per million of hypochlorite solution and dry the surface with disposable paper towels. Gloves and paper towels should then be discarded as infectious wastes. Perform hand hygiene, preferably with soap and water, given the exposure to body fluid risk. The following steps should be followed when cleaning up large spills of blood and other body fluids. Prepare by wearing non-sterile gloves or utility gloves. If contamination of the front of the body is likely, wear a single-use plastic apron. Note that the use of gown, mask, and goggles or face shield are not necessary. If a spill occurs in a traffic path, block off the area so that others do not step through it. Cover area of the spill with disposable towels or cloths soaked in 10,000 parts per million of hypochlorite solution and leave it for 3 to 5 minutes. Don't pour the solution directly onto the spill, as this may cause splashing and widen the area of contamination. Pick up soiled paper towels or cloths and discard into an infectious waste bag. Clean area with detergent solution. Wipe the surface area with fresh 1,000 parts per million of hypochlorite solution to disinfect. Then, rinse with water, as the hypochlorite solution can be corrosive. Remove gloves and plastic apron and discard as infectious waste in accordance with local policy. Perform hand hygiene, preferably with soap and water, given the body fluid exposure risk. 1 liter of bleach solution, such as Jik, contains 3.5% concentration of chlorine and is equivalent to 35,000 parts per million of sodium hypochlorite. To disinfect feces, blood, vomitus, or other body fluids, 0.5% bleach solution is required. To dilute the solution to 0.5%, mix 1 liter of bleach solution in 6 liters of water. You can pour out the 1 liter into a bucket of water. Then use the container to measure out water 6 times. This will give you 7 liters in the bucket. 1 liter of bleach solution plus 6 liters of water. The resultant solution is now 0.5%. To disinfect linen, equipment, surfaces, and for general cleaning, you need 0.05% bleach solution. To mix this, take 1 liter of 0.5% bleach solution from the mixture described above and add 9 liters of water. The result would be 0.05% bleach solution.